First of all, it was a great pleasure to work with Roberto Garbo. It's a friend. And in the context of a so complex procedure, the idea to link to different experience, the experience of Roberto Garbo in interventional coronary disease and my experience in the use of device for circulatory assistance was, I think, the good idea for the good outcome of the procedure.
Yeah, in the field of interventional cardiology, we face complex procedure and teamwork is essential. And we have here in Maria Pia Hospital a great team, and in particular in this case we have seen that the team did a great job.
This was a very complex case because of the presence of a complex coronary anatomy, and so the procedure was a very high risk procedure, and at the same time for the presence of a respiratory failure. And so we decided to use ECMO and not to use Impella because we needed both support of circulatory and also respiratory support.
Yeah, we had to treat a young patient that after COVID pneumonia, he developed a distress syndrome, in which was a waiting list for lung transplantation. We had hard team discussion, and the patient has a surgical turn down because of that. So I discussed with Elvis about our strategy, and evaluating together the CT scan and the coronary angio, we decide our strategy.
Two were the complex aspect of the procedure. First of all, the coronary anatomy, very complex to treat, and the second aspect, the management of the ECMO assistance.
This case was a left main trifurcation with a chronic total occlusion and the bifurcation, the level of ostial circ. And in the last 10 years, we have a great improvement in tool that we need to use to treat this complex coronary intervention. So I think that new wire for CTO, new microcatheter, dual lumen microcatheter that were essential. The use of IVUS imaging in this case is essential for having a good outcome of the procedure. The great advantage of having everything all percutaneously, so the ECMO and even the PCI bifemoral approach was great because the patient was discharged after 48 hours in a great condition.
We are very happy because the outcome of the procedure was very good. The condition of the patient improved immediately, and after 1 month, the functional class of the patient is really good.
I know Elvis since 25 years. We started together studying cardiology, yeah. And I'm really happy to work with him because I think he's really a complete operator, and is able to work in structural heart disease and to evaluate the patient and the procedure. And so I think that was a great help in this kind of complex situation.
It was a pleasure for me to work with Garbo, not only for the friendship but also for the great experience that he always showed during the procedure, and with a great capacity to solve every problem during a coronary intervention. It's a really great operator.